screen here. Okay, so today's Lunch and Learn is about our Stride Biometrics. And our wellness committee decided that we would focus on different types of individual health measures this year. So the first session we did in the first quarter was on the new weight loss injection drugs. And then December's was on personalized strength training plans. And then this one they wanted to focus on individual health biometric markers and to tie that in with the upcoming health screenings we'll be offering here. So we're going to dive into the different metrics we measure with Stride and why we measure them in all efforts to help you take responsibility in your health and stay healthy as county employees. So we'll talk about first I'll cover like when we go out and do the biometric screenings for all county employees. Then we'll get into the lipid panel and break that down along with blood sugar and blood pressure and body composition as well. So we'll talk about why we measure each of those values and then what those values mean as it responds to your health risk and health condition. So first, generally I go out each year in March and April to do the biometric screenings, and we have always done it that way because the committee felt like employees would want to have those numbers ahead of time to help them decide if they're going to join the incentive program when we always re-enroll in our health benefits. So we always tried to complete those before it was time to re-enroll here at the end of April and May. With your new health insurance choices, so you could know, if it was worth your efforts to be in the incentive program. However, this year I'm going to try something different. I'm going to go out in May, first part of May, because what I feel like I've been finding is most employees don't hang on to those measures when I come out in March and April, and then come May, when they re-enroll, they're always calling me, asking me, where are those? And I don't keep them. So then we always have to redo them, or they have to go through a huge search to figure out where they put that piece of paper. So this time I'm going to do them at the time of enrollment so that once you enroll and sign up for the incentive program, you can go into the Stride portal and put your numbers in after you've had your screening right away. So hopefully that eliminates some of those lost numbers. And quite honestly, I don't think there's too many employees these days that are deciding whether or not to join the incentive program based on what their values are. So I don't think it'll be a huge issue, but if you feel like it was terrible timing, let me know. But be expecting that here, first part of May, when we'll be coming out to each of the county sites. So what are we measuring? First thing we measure is your lipid panel. And that includes your cholesterol and your triglycerides. And why do we measure your lipids in your blood? Primarily to assess your risk for cardiovascular diseases. These are chronic diseases that tend to be a little bit more preventable than acute diseases and tend to have long-term healthcare costs associated with them. So as a self-insured health program with the county, it behooves us to be healthy as a whole on the employee side so that our health insurance costs can stay contained and our premiums and stuff don't continually go up. So the lipid panels can help us identify if we're at increased risk for heart disease or stroke, high blood pressure, and even some metabolic disorders like diabetes can be linked to elevated lipids. But again, the main focus here, the reason we measure lipids is again to assess our risk for chronic diseases. When we go out, if you do the lipid screening through us, we do it through a finger poke that many of you are aware of. If you do a full blood panel draw from your doctor's office, likely they're going to take it out of your arm intravenously. We generally require people to fast, and that is because the foods you eat can sometimes impact your levels, depending on what you ate and how quickly or how close to when you were tested you ate. And it also it gives us a more accurate measurement. However, there has been discussion the last few years that it would be best to actually assess people without fasting, because how many of us actually are in a fasted state throughout our day? Most of us are munching throughout the entire day, so our body never really reaches that fasting state. So wouldn't it be better to see how our body's responding in general? on a normal day to day. So at some point we may get away from the fasting requirement. I'm not sure, but there has been talk of that in the medical field. So what does our lipid panel mean? The first thing you'll know when you do your cholesterol panel is you'll have total cholesterol, usually listed at the top. And backing up, cholesterol is a key component of your health. So you need cholesterol in the body. It makes up the cell wall, the cell membrane of every cell in your body. It is also a precursor to stimulate hormone production and to make hormones in the body. It helps with processing bile. It helps our body absorb nutrients because it is fat. And when it then becomes an excess, then it can become problematic. But in general, cholesterol is good for the body, and our body actually makes it on its own. So if we're not eating enough of it, our body will automatically make more. And if we're eating too much, usually our body will back off a little bit because it can respond to that. But we can override that by, again, having an unhealthy diet or poor lifestyle habits. So there's really no magic number for total cholesterol. They used to always say you want it below 200. Now they say below 180 because people were kind of taking 200 at liberty. Just like with blood pressure, they keep making it lower and lower because we Americans don't pay attention and think we're close enough. Anyways, but the more important thing I try to stress with cholesterol is that it's not necessarily what your total cholesterol looks like, but what each of those components of your total cholesterol look like. So then it breaks down into HDL versus LDL cholesterol. LDL stands for low density. HDL stands for high density lipoproteins. These are both cholesterol molecules. HDL is what we always talk about as like the good cholesterol. It actually goes into your arteries, removes that plaque, and those bad cholesterol molecules from the body, helps the body excrete them, and helps keep your unsafe LDL at bay. LDL used to have a bad rap as the bad cholesterol. And when people get measured and have high cholesterol, it's usually because their LDL is high, and then doctors get worried and put them on statins to try to drop their cholesterol to hopefully avoid any sort of heart attack or cardiovascular disease. However, in the last 15, 20 years, we've definitely seen a shift on what LDL looks like in terms of heart risk. So I wouldn't say LDL is necessarily the bad cholesterol anymore. In fact, it's the type of LDL in your system that is more indicative of your risk for heart disease than how much LDL you have. And we'll talk about that in the next slide. But because of that, if you've been with the county for a long time, when we first started Stride, we used to base your risks on total cholesterol. But since this new medicine direction has changed, we now don't use total cholesterol to indicate your risk. We look at the ratio of HDL, which is your good cholesterol, to total cholesterol ratio. And we want that ratio less than 4 in Stride. Medically, the newest research is saying you want that under 3.5, but we have not adjusted it in Stride yet. We can show anything under 4 as being optimal as far as a risk factor. But again, the purpose of that is to, again, know that we want to focus more on the protective side of HDL and not kind of that ambiguous total cholesterol number that doesn't really show a good indicator of what heart disease is and your risk for it. Triglycerides are another important part of your lipid panel, and I would say almost more important than your cholesterol levels. Triglycerides are the fat storage particles in your arteries. So these are their plaque builders, right? When these get elevated, your arteries start to shrink because they're getting filled with plaque, making it harder for that blood to get through, leading you to increased risk for cardiovascular diseases like stroke and heart disease. In our Stride program, we like triglycerides below 150 milligrams per deciliter, same as what's recommended in the general medical standards. I talked about how LDL is not the best indicator right off the bat. The way LDL is calculated from our test is it's a formula calculation. It's not actually measured by number in your blood. And if you would go to the doctor's office, they do it the same way we do. It's calculated. So it's not actually giving you the exact number. And this can be sort of problematic, but no medical facilities are really willing to invest in newer testing and technology to do more accurate LDL measurements. But if you have a family history of heart disease and your triglycerides are elevated and you're a little nervous of your LDL, I would encourage you, and I usually tell people at their screening, to consider doing more advanced LDL testing to get a better idea of what the risk is for cardiovascular disease. So these are 3 other LDL tests you can have completed with your blood. I called Mercy here in town to see if they offer these yet, and they still don't. So most of the time you're gonna have to go online and find a lab who will screen these. A lot of times you can do it online for under $100, but they'll send you a little vial to collect your blood. You'll put it in there and you'll ship it back to them. Mayo may do this if any of you doctor up there. I did not call them, but locally we don't have anyone providing these tests. But the tests include lipoprotein A, and this is a specific LDL particle that they can measure. And we know that if you have a lot of this particular LDLA, you are at a significantly higher risk for cardiovascular diseases, up to 6 times more likely to build plaque at faster rates than someone who has low levels of lipoprotein A. This is a very genetic marker. So if you have a family history of high lipo A, chances are you probably also have high lipo A. And it's just good to know because you're going to be at a much greater chance for massive heart attacks, that kind of stuff, if you're not careful with your lifestyle habits. The other 2 tests that aren't so genetic are LDL particle size and particle number. Particle size, they actually can measure what type of LDL you have. There's 2 versions. There's sort of like the cotton ball LDLs, and those are nice and fluffy. And so when they're going through your blood vessels, they're not really causing any damage, right? Because they're just soft and bouncing off the walls. But if you have the hard little LDL particles rather than the fluffy kind, those start to cause damage and increase your risk for heart disease because they're banging against those arteries and those vessels and causing damage. And whenever you have injury happening, your body's responding with scar tissue and plaque buildup and stuff, again, increasing your risk for cardiovascular disease. So knowing the size and the type of those LDL particles can be very important. And you can test specifically for particle size and number with these alternative LDL tests. Again, you're going to have to go online and find somewhere who's offering to do this, or maybe check with Mayo if you go up there. They probably have the technology. But our local healthcare system does not. And that's why we also don't check for it at Stride. But if someone does have elevated lipos, particularly triglycerides and LDL and low HDL, then we know we've kind of got some risk factors that are not looking so hot. So what does, I already talked about the ratio that we look at now for Stride rather than just total cholesterol. Things that really can impact your cholesterol, one are including a diet. Excess sugars and trans fats really increase your lipids and triglycerides. Lack of exercise is also very harmful to these levels. And in reverse, the more exercise you provide, the better these levels get. And then genetics can play a role, like I mentioned as well, in your risk for lipid levels. All right, triglycerides. I already talked about this, so I apologize. I forgot I had my own slides on it, but this is the plaque that builds up from triglycerides when we eat too many sugars, too many trans fats, and aren't burning that for energy through exercise. Our body's going to convert it to fat and store it, and unfortunately, it starts to store in our arteries along with other places in our body. And so just like cholesterol, we can impact this by having good exercise, managing our sugar intakes and our trans fat intakes, and avoiding unhealthy behaviors, which we'll talk about a little bit too. All right. We also measure blood sugar in Stride at the screenings. Blood sugar indicates how much sugar stays in your blood after meals and in between. And if these blood sugars are consistently high, especially in a fasting state, we know that we have some sort of insulin resistance going on in the body. And insulin resistance means we likely have diabetes or in the pre-diabetic stage. And basically that means is we are just overwhelming our insulin system because blood sugars have been kept too high for too long that it becomes unresponsive, sort of. And so we're just not able to pull that glucose out of the blood as well as we once could, leading it to stay elevated and causing issues. The new medical guidelines are to aim for a fasting glucose below 90 for stride. Our recommendation is below 100. Again, they keep moving it down because people feel like 100, if I'm at 115, that's close enough. So now by going to 90, they're hoping people will think 100 is, as far as they should risk getting to. So, um, there's also, especially if someone has diabetes within the county, we also offer the option for them to report their A1C rather than their blood sugars because that's a better indication of how well they're managing their blood sugars, especially if they do have diabetes. An A1C is basically a 3-month average of what your blood sugar has looked like over time. It's a percentage rather than a number of milligrams or deciliters. So anything less than 5.5% is recommended for an A1C. In stride, we say anything less than 7, giving a little bit of wiggle room as the new medical guidelines, again, keep getting stricter to hopefully awake people and make them make some changes. And so when you go into the Stride portal and you enter in your values, it'll ask you to put in your blood sugars, or if you have diabetes, to put in your A1C, because that can be a better indicator of how well they're dealing with their blood sugars. Um, Issues with having high blood sugar, one, obviously, diabetes is always a risk, but so is heart disease. Those two go hand in hand. And it can lead to hypertension too, because excess sugars in the blood can damage our nerves, our blood vessels, and heart. So many issues beyond just diabetes. And same with cholesterol and triglycerides. Blood sugar can usually be managed or controlled through lifestyle habits. So balanced diet, limiting excess sugars and carbs, getting regular physical activity. It's actually shown to be very beneficial for people to exercise after they eat if they have issues with blood sugar, because then you're getting that blood sugar out to the muscles rather than having it stick in the bloodstream after you just ate. So walks and stuff like that for people with diabetes immediately after their meals is very helpful. And then blood pressure. That's another thing we measure at your screenings. Blood pressure is the amount of force exerted by the blood against your blood vessels, the arteries in your body. There's two numbers. The systolic is the first number or the top number, and the diastolic is the bottom number or the second number. Systolic pressure is the amount of force when that part is pumping and that blood is really pushing against the arteries. The diastolic is in between the beats of the heart, so when your heart's at rest. And so that number is usually lower because there's less pressure from that force of the heart beating. So you can see where the cutoffs are for stride. We like systolic to stay below 130, and we like diastolic, or the bottom number, to stay below 90. Gold standard is usually 110/70 or below. But anything above 140/90 is considered stage 2 hypertension or high blood pressure. So again, many issues with that, but people always wonder what those two numbers mean, and it's just a variation in the pressure in between heartbeats. If you have high blood pressure, there's a cascade of health issues that are associated with it, all pretty much chronic disease related. Cardiovascular diseases like heart attacks, strokes, heart failure. It can damage your kidneys. It can cause eye problems, brain damage, issues in your legs and your arms as far as getting circulation and pressure and blood to those areas, and even metabolic syndromes can exacerbate from high blood pressure too. So certainly an issue you'd like to get in control if you can. And same principles apply. Regular exercise, limiting unhealthy foods, staying away from tobacco products, that kind of stress can elevate blood pressure, lack of sleep, all those things we talk about all the time. And then the last thing we measure is body composition. Before we had the InBody, we just used to use the BMI formula, which was just height and weight, so it really didn't do a good job of indicating things. So now that we have the InBody, we also offer the option to report based on percent body fat rather than just height and weight. And so you can see up here, oops, sorry, too far. This first box, BMI, typically we like individuals under 30. We in stride, we allow for overweight individuals. Actually, studies have shown once you get to a certain age, usually about 65 or above, being overweight is more protective than being underweight or at the ideal weight because you have that extra fat and sturdiness, so to speak, to help you live longer. But too much weight obviously becomes a major issue. Percent body fat, this also fluctuates. I believe for women, we say we want you below, oh, let me look. I don't want to be wrong. I was going to say 36%, but maybe I am misquoting that. Let me see what it says. Sorry, it's opening slowly. Oh, here it is. We say, oh, that's the old one. Um, Okay, I can't remember. I'll look. So anyways, I'll talk about this here in a little bit. There's also other ways to measure body fat percentage and muscle percentage, and that would include underwater weighing, which I don't have that capability to take everyone and dunk them underwater. We can do skin folds assessments, but that's sort of a little invasive for most people. And waist circumference also can give you a good indication of your risk for heart disease because if you carry most of your weight around your heart or your torso rather than your hips and thighs, then it's also at an increased risk because of the stress it places on your organs. But the InBody has been nice because it does give a good indication of percent body fat. Of course, tobacco use is an absolute no when it comes to the STRIDE program. So any use of tobacco is definitely a risk factor in the program. We do have some good programs to help people quit, including Quitline Iowa, which is free. So if you need support, we can get you hooked up here at Public Health, and they even have free nicotine replacement therapy. So if you need medications for a certain set of weeks to help kind of wean you off that addiction, those are available too. If you're pregnant, they have even gift cards for signing up for the program. So there's a couple perks too for certain populations. So I mentioned about body composition. Our strike committee, actually this last quarter, it was probably in December, maybe before December, we proposed to HR and Board of Supervisors to adjust the things we consider risk factors for the STRIDE incentive program. We wanted to remove the weight measures, so BMI, percent body fat, and replace them with more behavioral type risk factors, such as physical activity level and dietary intake. And our thought process behind that one is the medical field is going towards a big push called weight neutral assessments, which basically means not using your weight as an indicator for disease risk, but rather your behaviors and your lifestyle and more clinical measures to assess your disease risks. And this makes a little bit of sense if you think about it, because you probably all know people who are super skinny, but are terrible with their health and probably could have a heart attack at any time, right? They're probably sticking bones, drink and smoke, and can't put on a pound of weight if they wanted to. And then on the reverse, you might have someone who is always overweight, but works out all the time, tries to eat as good as they can, avoids all substances, and just is overweight. And so if you look at those two individuals, which one would you be most worried about health-wise? Well, probably the one who's smoking and drinking and 50 pounds underweight, but yet BMI, percent body fat and stuff wouldn't necessarily show that. So our proposal was to move some of those weight measures and replace them with more lifestyle questions as risk factors, because we know the benefits of exercise and healthy eating probably far outweigh just what the number on the scale says about your health habits. So we haven't heard back yet if that's a go. I'll let everyone know if we can get it in place come May when we re-enroll, but that is the proposal on the table right now. So we'll keep you posted. If you're new to STRIDE, here are the risk factor requirements, just a reminder. All those things we talked about, if any of them are elevated, they're considered one risk factor point. So then however many you add up is how many wellness points you have to earn throughout the course of the fiscal year. So to wrap up, just quickly, one, we do these screenings again because of the importance of trying to reduce chronic disease and helping individuals stay on top of what their risk might be. So we know regular testing can help us make better informed decisions. And of course, it just gives us that opportunity to talk with individuals about adopting those healthy lifestyle behaviors and giving them tips or tools to help them kind of stay on that path. So that's why we go out and do biometric screenings. So that's all I have. Does anyone have any questions? I'll stop sharing if anyone does. Otherwise, I will be out in May to all the county sites to do our biometric screening. So there'll be signups in all the break rooms usually. So you can get a slot, and then I'll have the in-body there as well, so you can do your body composition testing too if you want. And I should also note that the STRIDE incentive program and all STRIDE challenges, activities, screenings, and stuff are always optional. So nothing is required by any means. So if you're not into earning extra money through an incentive program, you don't have to sign up for it. If you don't like doing biometrics, you can go to the doctors and use their values or skip it altogether. We just want to provide you with tools and resources to take advantage of if you so want. So, any questions? All right. Hearing none, I will stop the recording and we'll post this to our Stride YouTube channel in case any of you want to watch it again or pass it along.